There's a couple of different options when you're getting ready to leave the hospital after surgery. Like Vince said, I do follow, and we have very good communication on the floor as far as I ask him on a daily basis, or the therapists that work with you on the days after Vince works with you, how you're doing. Because usually that first day is difficult, and that might not say how you're going to do the next day or the next day. But I do start that discharge planning process on that first day after surgery with you, after Vince sees you. A lot of times the orthopedic surgeons have certain home health companies that they like to use. You might want to talk to your surgeon about that. St. Joseph's Hospital has BayCare Home Health, which of course we like to use our own. They're very good. But you can talk with your surgeon about that if you think that you're going to be going home with home health. They come out to your house about 3 times a week, and therapy is about an hour, hour and a half in your own home environment. And they'll do exercises with you, and you'll be doing that with them in your home. We do like to say that we want you to have a safe discharge plan. You have to be able to get out of your home if there was a fire. So if you have a full flight of stairs and it's taking 2 people to help you out of bed, and your bedroom's upstairs, things like that, it doesn't sound like a very safe plan. And we do care, and we want you guys to be successful with your surgery. So if you are needing a little bit more help, and sometimes people do choose to go to a rehab, because in the rehabs you do get therapy every day. In some are 6 days a week, some are 5. It's no less than 5 days a week that you're going to get therapy, and you're going to be in an inpatient setting in a facility outside of the hospital, and they would, you're going to have nursing care, techs, the same kind of things that you would have here in the hospital, and they will take care of you, and you'll have that aggressive therapy before going home. It's a great idea for you and your loved ones to go and visit these facilities ahead of time. Even if you think, well, I want to go home, but I might need rehab, at least you'll have a backup plan, and you'll have visited these places. It's very important to go inside and tour. You can go at any time. The places are open 24 hours. They can give you tours. You can go in and look around yourself, say that you're having surgery or your loved one's having surgery. Ask to see their gym, talk to their physical therapist, talk to their nursing staff, take a look around, and you'll get a feeling if it's the kind of place that you'll want to be for a couple weeks, sometimes just a week. Sometimes people just go for 5 to 7 days after, just for that extra boost, and then they go home. But the facilities are on this form here, and then on the back is a map, and you kind of can see where they are. And then I've also included an insurance list, because if you have straight Medicare, you can go to any facility that you want. All the facilities take straight Medicare. But if you have an HMO Medicare or any other type of insurance, I've included this, and this has the insurances listed and the facilities, so that you know which ones take your insurance. So you're not visiting places that don't take your insurance. If you are going to go from the hospital to a rehab, you will not get your equipment from the hospital. You'll get it from the rehab center. They'll order it for you from there when you're leaving. The standard equipment is what Vince had said, the rolling walker and a 3-in-1 commode, or a bedside commode. Those are the standard things that are ordered. The bedside commode, it's a really neat thing. It acts as 3 different things. It acts as a raised toilet seat with handles. So with the hip surgeries and even with the knee, it helps you lift yourself up off the toilet comfortably. It acts as a shower chair and also a bedside commode next to your bed when you go to bed for the night. It's right there. So those are the 2 standard equipments that we order. But like I said, if you are going to rehab from the hospital, I arrange all of that for you. Your job is just to be a patient. We have staff in place, myself, and then we also have a home health person that will take those physician orders and get the home health care set up for you in your home when you're leaving. And then I handle all of the rehab stuff. I send all of your information there, and then I also help set up the ambulance. People do 99% of the time go by ambulance to the rehabs, and you do qualify with your insurance. I do all the forms for that. And then we get you safely from your bed here in the hospital to your bed at the rehab. So if you are going home with home health care, we will order the equipment for you and it'll be delivered to your room and you'll take it with you. So, and I also like, just to let you know, the home health company and the skilled nursing facilities, the rehabs, it's your choice where you go. This is your plan, and I'm just there to help you with it. So we can talk about that, and I'm there Monday through Friday, social work, and even social work is there on the weekends to help with anything that may come up. That's what we are there for. We want to make sure to get you home safe.
One of our things, if you're kind of borderline, should I go home, or should I do this, or should I do that? If anybody's borderline, something that we like to take into consideration that might put things into perspective for you is we say, God forbid if there was a fire in your home. Are you able to, or the person taking care of you might be able to feed you and get you the things that you need, but would they be able to get you out of the house in case of a fire? And if that support system is not in place, that's a consideration that you may want to take for some rehab if you're not mobile enough to do so yourself.
And also just wanted to add that plans can change too. Like I said, the first day after surgery, you're groggy, you might not do as well. And Vince may say rehab, and I'll talk to you about rehab. And then the next day, or even your last day here, you're walking down the hall, your plan can always change. If you're kind of borderline, sometimes I like to get 2 plans in place. I have you, pick out a facility or 2 just in case, but we know that you want to go home with home health. So things are not ever set in stone. Those plans can change, and that's why I'm here, charge nurse, Vince, we're all here to just make sure that we're watching how you're progressing and, accommodate you with what you need when you leave.